will reduce your risk? So we're just going to look at a few elements here, what it is that you can do that is within your control. Okay, firstly, so I've been talking quite a bit about the endothelium and how it gets damaged. So it's kind of obvious that if we protect the endothelium, that it will reduce our risk of heart disease, right? So where a high glucose or a high sugar level is damaging, a high protein level is protecting, even a high fat level is protecting, because it provides the raw material that allows it to be kept strong and healthy. And the endothelium needs protein to make it, to repair it, to replenish it. So that's a very important shift that you can make, just making sure that you're having enough protein, enough fats in your diet. And then next, nitric oxide. So I wonder if you've heard about nitric oxide before. You can maybe share in the chat box if you have. But it's really impossible to overstate the importance of nitric oxide on cardiovascular health, because nitric oxide dilates narrowed arteries. So it's really so powerful. It also lowers blood pressure by opening up the arteries elsewhere in the body as well. And it's a very powerful anticoagulant agent, which means that it prevents blood clots, right? It even improves insulin sensitivity. So you can see with all the risk factors that we've discussed, it kind of addresses all of them. So anything that reduces nitric oxide's production will increase the risk of cardiovascular disease, and of course, vice versa. And once again, the action of sunlight on the skin, for example, creates nitric oxide. So once again, the importance of getting outside. So how do we increase nitric oxide, and where do we get it? So one of the elements, or one of the things you could do, is more exercise. So the more we exercise, the more nitric oxide synthesis. Relaxation techniques that helps with that, increased sun exposure, breathing through our nose, quite an interesting one. And then some veggies, some fruits and veg contain quite a bit of nitric oxide. So just a quick mention on breathing through the nose. If you breathe through your nose, nitric oxide actually gets into your lungs and your blood vessels, and that dilates once again the airways and the blood vessels in the lungs and elsewhere. And Cleveland Heart Lab, you might have heard about them, and they said that it's so beneficial to take long deep breaths through your nose, because it helps to release nitric oxide, which has been shown, and this is listed on their some of their platforms. They say that it expands our blood vessels, it increases blood flow, lowers blood pressure, reduces stress, reduces stress, and produce an all-over calming effect, and it prevents the build-up of artery clogging plaque. So quite a bit of a magic food even. And we can eat to increase nitric oxide. And there's quite a few vegetables and fruits that contain quite a bit of nitric oxide. And I think top of the list is probably beetroot. So beetroot contains a lot of nitric oxide, and it's also extremely beneficial for sports performance. So for those of you who are interested in that area, the more nitric oxide, the more oxygen is actually available to the muscles, which really helps with the performing and the elements of increasing your performance when it comes to your sports as well. Also a bit of nitric oxide in garlic, our leafy greens, citrus fruits, nuts and seeds, watermelons, but beetroot is definitely top of the list. Okay, what else can you do to reduce your risk? So short bursts exercise, also very beneficial, and this is because short bursts of intensive exercise burns glucose most. So that's our sugar, the things that are harming, causing the inflammation in the arteries. And our short bursts are anaerobic, which means that it does not use up oxygen, and it relies entirely on using that sugar. So it's only going to use the sugar instead of fat for the fuel, right? So if it's maybe a longer cardio session, then it's more going to tap into your fat cells probably. So if you burn the glucose with a short burst, then it's going to help to manage the insulin, reduce the inflammation, etc. And then the last one is the dietary fiber. So we also know that dietary fiber is associated with a lot of cardiovascular benefits. I think when it comes to food, it's really about making sure, once again, it kind of comes down to the same thing, where we need to include more variation, right? The more variation we're getting, the more different nutrients, or how, we can make sure that we are getting all the different nutrients that we need, that we've discussed today, and getting enough fiber to also protect the heart in that way. Okay, so what if, so let's say your cholesterol levels are high and you are worried. What other tests are there that can maybe give you more of a, can give you more peace of mind and is maybe more reliable in terms of whether you are at risk for heart disease? So something that I found is very reliable here is the coronary calcium score. And you can share in the chat box if you've maybe experienced the same thing, if you've maybe did this test yourself, or if you're a doctor, if you would recommend it. But what it basically does is it measures the degree of calcium buildup in the coronary arteries. And it's a 5-minute test. It's done with low dose X-rays. And then that calcium that's found in the coronary plaques is also a marker of inflammation, within the arteries. So you can see here on the screen, 0 to 100 is a low risk, 100 to 400 moderate risk. You can read through that. But what's really interesting here is that there's no significant change in the progression of the calcium score in patients taking statins. So even at the highest doses, and despite significant reduction in LDL when they take the statins, there's no change in the coronary calcium score usually. So more consistent predictors are typically your progression or more consistent predictions of the progression of the coronary calcium are high blood pressure, diabetes, high blood triglycerides, smoking, and low HDL cholesterol. So those are the things that seems to be directly linked to heart disease.